The Public Relations Society of America St. Louis chapter had planned our Coronavirus Preparedness for Communicators Summit for today. However, because of the exponential daily changes and fast-moving scope of how this virus has exploded globally, we have asked some of our original speakers to video their presentations. On behalf of the Board of Directors of the St. Louis chapter of PRSA, we believe the health and safety of our members should be of the utmost importance. That's why we have taken the steps to cancel all in-person professional development and networking events in the foreseeable future. However, we also believe it's equally important to continue to improve the lives of our members by taking an active professional stand and leading by example. Our goal with this video is to challenge you as a communicator in the St. Louis region or beyond to be more effective in your decisions, your actions, and in your career. We want to help you become more successful in navigating this crisis which we all find ourselves in. For more professional development videos, please go to our Facebook page at PRSA St. Louis. I'd now like to introduce you to Dr. Jameca Falconer. Dr. Falconer is an accomplished counseling psychologist, educator, entrepreneur, author, civic leader, and holds a Ph.D. in education and counseling psychology from the University of Missouri-Columbia. Dr. Falconer is one of the leading providers of psychotherapy services to older adults in the St. Louis region. She's a past president of the Association of Black Psychologists, St. Louis chapter, and currently the public education coordinator for the Missouri Psychological Association. Much of Dr. Falconer's community involvement and scholarship has focused on increasing the awareness of mental health conditions and decreasing the stigma associated with mental health in communities of color. Dr. Falconer teaches several classes at Webster University right here in St. Louis, Missouri. I'd like to introduce you to Dr. Falconer.
Hi, my name is Jameca Falconer and I am an adjunct faculty member at Webster University. I'm also a licensed psychologist and a program director at Webster University over the Applied Educational Psych and School Psych programs. I am very excited to be speaking with the PRSA about panic about the coronavirus and what to do about that in the workplace. So first, I would like to talk about how we're going to deal with it. And to do that, we have to first start off by talking about what is panic. So what is panic? Right now, people are thinking lots of different things, lots of different fears and worries about the coronavirus. I don't think that most people are feeling what we as psychologists call true panic. So to be diagnosed with a true panic, you would have to experience some of these symptoms. So a panic attack is characterized by 4 or more of the following symptoms. Hopefully you can see these: palpitations, like a pounding heart rate, sweating, trembling or shaking, sweating, sensations or shortness of breath, or maybe you could feel like you're smothering, a feeling of choking, chest pain, nausea, feeling dizzy, feelings of unreality. We call that derealization in my field. Fear of losing control or going crazy, fear of dying, numbness, chills, or hot flashes. So you would have to have at least 4 of these symptoms in order to be diagnosed with having a true panic disorder. So what I assume is that most people are just experiencing maybe a few of these, if any of these, but overall more just worry and stress about what's going to happen, when it's going to happen, and how is it going to happen. Why all the panic? You've probably asked yourself that. You probably talked to your colleagues about it. Why all the panic? And I guess if you were to ask 5 people, you would probably get 5 different answers. So most people believe that the panic is because we don't know what's going to happen. Most people panic and worry because of uncertainty. They don't know what's going to happen, how it's going to happen. And with this, as you've seen with the news over the past 30 days, it's rapidly been changing. So we don't know how many people are ill with it. We don't know how many people are dying with it. And we don't know how to get infected, how not to get infected. So lots of things that are really uncertain. And that seems to make people worry and have panic. So there are certain types of workers that in this time are going to be more panicked or more worried about their exposure to the virus. Some of those workers could be restaurant workers. Think about when you go to pick up food, because right now you can't go dine in anywhere. Well, at least as of tonight, I think in the St. Louis County area. But you have to go pick up food, but how are the workers feeling that have to prepare your food and get it ready for you to take it away? And then there are other workers who maybe work at the mall and they have not been at work for days or weeks now because of this issue. So workers, restaurant workers, could be panicked just because of the influx of the numbers of customers that they're seeing that they don't normally see. Next, you would have grocery workers. So these are the people that are stocking the shelves and checking us out of the grocery stores. And I'm sure many of you have been in the grocery stores in the past 7 to 10 days, and we all know that the shelves are bare in most stores. What's interesting about this is that not all the shelves are bare. Chicken is gone. As of yesterday, ground beef is gone, toilet tissue is gone, and mostly paper towels. What's interesting is that the napkins are left. So that's an option for people as well. So the grocery workers who have to stock the shelves probably come in early and work longer hours, probably have to do more cleaning and sanitizing of themselves and the places where they work. These people would especially feel a lot more panic these days. And actually what I heard about today on the news is that in Vermont and Minnesota, grocery workers have been declared like emergency workers in the state, just because of all the panic and worry and the extra work. So then the last category of workers that I think will probably feel more panic than usual would be healthcare workers. So these will be our doctors, our nurses, and people like me who are mental health professionals. And I don't think people think about it a lot, but we really don't stop working in times like this. Now we might alter the ways that we work. So for instance, I'm doing a lot of video sessions lately, but I also still see people face to face. So there is always a risk of exposure depending on where I see them at. I see some of my patients, my older patients in nursing homes. So we all know that that is a really big risk of exposure in those type of facilities just because of the normal rates of virus and illness that go on in those areas. So already it really kind of depends on who you are, where you work, and what your exposure is. The one thing that is very important in this situation, depending on who you are, it really doesn't matter where you work, but communication is key. And if you're like me, your inbox and your email has been bombarded with various types of emails from all types of organizations or businesses that you're affiliated with. So communication is important. That's why everyone is getting all these emails. So it is important to let your employees and your staff know what the plan is. What is the plan? What are we going to do? It's important to let your employees and staff know that you have a plan, that you've thought about it, and that you're thinking about and concerned about what's going to happen next. So email is one way. I think it's also good to have handouts or hard copy information for some people as well, just because everyone really doesn't learn and internalize information in the same ways. Make sure that you are not conveying panic and anxiety yourself. How do you do that? Well, you simply comfortably talk about the problem and the issues at hand. So you at least try to come across as if you're not worried and you're not panicked, although internally you could be feeling some type of panic. But you have to convey to your staff that you at least have things under control so that they can feel more comfortable feeling like they can trust you and listen and take things easy as this process plays itself out. So main thing here, play it easy, be calm, have your information together so that you do feel more comfortable when you talk to your staff and employees. What's really important here is that you have to focus on being prepared. So you want to emphasize preparedness as opposed to fear or anxiety. That's very important because in times like this, we have to all be prepared. What it means to be prepared in the workplace is going to be very different than what it means to be prepared in your own home. So multiple steps. In the workplace, what are those steps going to be? It could be simple sending out an email. That might be your first step. Or maybe it's talking to the higher ups or your management team. That might be the step that precedes that. So then communicating with your staff might be one of the steps. So there are going to be a lot of different things that go into this. But one of the steps in this process is probably going to be what to do. So actually, how are you handling this situation? And I've heard that a lot of companies have already sent their employees home to work from home. So they're doing telework, or they're flipping and doing, some people go in this week and then other people go into the office this week and then people rotate just to have coverage in the office. I've heard about people all working from home in their office. I've heard about people all working from home in their office for the next few weeks. So I've heard a lot of different ways that people are handling it. And I'm sure there are even offices that are still working in their office. So I think there are lots of different steps to take. And in most cases, one of the first steps is going to be to review your policies. So what does your policy say about sick leave? What does your policy say about missing time? What does your policy say about if you need childcare emergency or if you need some type of emergent health care? What does your policy say about any of this, working from home? I think this would be the time where you would revisit some of these policies and make sure that everyone is clear and on the same page. One of the very important things about the coronavirus, no matter who I've spoken to about it and no matter who is really getting the information, you have to present accurate information. Now, that's very hard to do given the rates that this information is changing. What the news will say about coronavirus today is going to be very different than what the news said about it 3 weeks ago. So it's always important to present accurate information. Things like how many people in the United States have been impacted by this disease. Other things, how many cases in your area. So how many cases in your state, how many cases in your city, how many cases in parts of your city. Those type of things are really accurate information. And it's important to present that because many times people seem to inflate those numbers in their head. So in their heads, there are thousands of people in your state that have been affected when in actuality, there are only a handful of them or not even 100. And with the coronavirus, one thing that's very important to remember is that we don't have the ability to test large amounts of people. So the numbers are going to be low until that at least changes. And I know they're working on the testing to try to get test kits out and available to different states, but right now we don't have them. So the numbers are going to be low until that happens. Now, that doesn't mean that many people aren't affected. It just means that confirmed cases are going to stay low until the test kits arrive and more people can be tested and confirmed. But it's always important to present accurate information so that the people who are stressing out or anxious or worried can tend to inflate those worries, but we want to help calm them down a little bit with the best information. So it's also important to discuss solutions and alternatives. Like I said earlier, working from home is an option for some people. Working from home is not always an option for some people. Like I said, for me, although I do video sessions with most of my patients or my clients, I cannot do video sessions with all of them. For instance, my patients that live in residential facilities, long-term care facilities like nursing homes, because many of them don't have smartphones, tablets, or laptops. So for those people, I have to, as a healthcare professional, go to see them and make it easier for us to have our continued services. So certain people like me don't have the luxury of not doing it or working from home all the time. Flexible schedules. That's also a very important piece of this puzzle, because as an employer, if you want to give your employees the best chance of being able to continue their work and the best chance of having less anxiety, you should be able to provide the best possible flexible schedules or work environments that you can provide. So for some people, that will mean working from home. For some people, that might mean schedules like going in earlier, staying late, split schedules, coming in a few hours in the morning, going in a few hours in the evening. For lots of people who have school-age children, they're going to be impacted by the children being at home, so they might need a little bit more flexibility than other people. So maybe you have childcare on site. So these types of things and offering them to your employees would be one of the ways to help reduce anxiety in this time. One of the most important things that I have to stress to everyone is that if you, as an employer or an employee, feel stressed or feel sick, if you're coughing, if you have a fever, if you have shortness of breath or any of these symptoms, please make sure you tell someone at your job and make sure that you do your due diligence and stay home and try to stay away from people. In times like these, we don't really know enough about what's going on or how we're passing on illnesses to our partners and our neighbors. So the best things we can do right now is to try to stay away from people. So that's the most important thing. That's the take-home message here. Anxiety for everyone in our community and in the society is going to be kept at bay if everyone can really get this big message, which is if you feel sick, tell someone, stay at home, stay away from people so that we can keep the numbers down. What can we do to help reduce the panic and the worry in our workplaces, in our communities, and in the society overall? Many, many answers. There are a few things I would suggest. One of those things would be to do your own research. It's very easy to listen to your coworkers or your friends and your family. Sometimes they catastrophize the information. Sometimes they inflate numbers. Sometimes they give you blatant, incorrect information. Certain things like, we know the virus came from this place. We know that if you eat this type of food that you can get it. These are just rumors. They're not even factual. So you have to be really careful about who you listen to. Always the best thing that you can do for yourself is to find your own information. Where can you find it at? If you have internet service, of course, you can go online and look. You can check places like the CDC, the Centers for Disease Control, the World Health Organization. All those places have different types of information that will be based on your city, your state, the country, and you can look at the global numbers as well. But that would help you get the best information so that at least you can be updated on what's accurate and how fast it's spreading or not spreading. The other thing I would say is, in times like this, everyone has been instructed to stay at home. Mass gatherings have been outlawed, really. Games have been canceled. Graduations have been canceled. So in times like this, I would suggest that everyone be kind to each other. I think it's really easy because if I just use myself for an example, usually what my week consists of is going home after work at 5, taking my teenagers around to their different activities, preparing meals, going to meetings, finishing up work. So at least for me right now, I don't really have any activities to take anyone to because all activities have been canceled. Food, I still have to prepare that, but meetings have also been canceled for now, or they'll either be moved to an online format. So for me, this all makes my life a lot easier. So I'm very thankful that everything has kind of been taken down for a minute and I get a time to rest and to breathe and catch up on things. So all of our neighbors are also going through the same thing. So this will be the time we can be kind to each other. Look out for your neighbors, see if they need any help, especially your elderly neighbors who can't maybe get around as much, or they don't have the time or physical ability to wait in long lines to get things. This will be the time you reach out to them and see if they need any help. So being kind to one another is a very good opportunity for us right now. Being patient. I talk to my patients all the time about patience in this time. They're upset about not being able to see their family members as much as they would like, and not being able to go out to eat with family like they usually do. These are things that older adult patients really look forward to. People are upset that they can't go to their relatives' graduations. Lots of reasons to be upset. Lots of reasons to be upset and impatient with the government, because sometimes the government has not given us the best answers in the most efficient way. But what I always try to tell people is, let's just all relax and be patient while everyone figures it out. So for you as employers, that's going to give you some time too. You have to be patient with yourselves and figure things out. Your staff has to be patient with you, but everyone in society has to be patient with each other while everyone figures it all out. No one has all the answers because it's never happened to us before. This is all new for everyone. So we're figuring things out as we go, day by day. And then the last thing I would suggest is, if necessary, if you feel like you have a level of anxiety, stress, or worry that's above and beyond what's normal, or above and beyond what you should have, just based on things that are going on, don't be afraid to seek professional help. So that could be professional help in the form of a mental health expert, so a psychologist like me, counselor, social worker. It could be clergy in your church, or it could just be speaking to someone in your workplace that may be available to speak to you and talk to you during this time. But if necessary, if you start to feel like you're having problems getting through the day or managing your anxiety, I always suggest seek out professional help. It's never too late. Sometimes, well, no, block that out too. One of the things, I don't know if you can see this, is this clear from where you are? Okay. So one of the things that the government and the news has been recommending is the social distancing. So what does that mean? I think it means staying to yourself while we figure out the numbers and while we can keep the numbers down. The phrase that everyone has been using is what? Flatten the curve. But the social distancing helps to do that. So what that means, so if you are in environments like me, I still have to see patients. I try to maintain distances of 6 feet. So even if I'm with the patient, I'm at least a good distance away from them. And that's important because if they sneeze, then I'm still a little bit over here. Or if they cough. And what I notice, because I talk to people one-on-one a lot, I notice that sometimes when people talk, just regular talking, things are coming out of their mouths. So if you stay back a good 6 feet away, you can at least keep yourself safe from that. Now, for those of us who are healthcare workers and work in hospital settings or long-term care facilities, we have to go an extra step. So we're also using masks, lots of spray and disinfectants, hand wipes, and the social distancing. So in your homes right now, just because we don't know that everyone has it if they have it, so some people can be asymptomatic, it's important for all of us to practice the social distancing, even in your workplace. So if you're one of those workers that doesn't have the luxury of working from home, this would be something that you would still need to practice even in your own workspaces. But this image I just put here just to remind people that everything takes time, and we're all figuring this whole thing out, and it will all get better. We know that it will. We just have to kind of sit and wait for it to play itself out. And in the meantime, we can all be safe while we're doing it. Thank you.